Hi class, welcome to the first half of your senior year. My name is Susan Ye and I will be presenting the wound healing unit of instruction. So this unit of instruction is part of your medical surgical course that is linked to your clinical. Before we get started, we're going to talk about the 6 main functions of the skin. Now the skin is the largest organ in your body and it controls body temperature. It protects us from harmful substances such as germs, UV rays, and the heat. It also functions in secretion, sensation, and excretion, as well as vitamin D production. Now, in terms of classifying wounds, it might be difficult. For example, if you look at this title page slide, you can see that there are a multitude of different wounds located here, and it's tough to determine which one is which and how to treat it, what are its causes, what are its risks, stuff like that. So for this unit of instruction, I'm going to focus on the top 4 most popular ones that you're going to see in clinical. So the first one we're going to start off with is pressure ulcers. Now, pressure ulcers are localized injuries to the skin over a bony prominence due to unrelieved pressure. There are a lot of factors that play into the development of a pressure ulcer. For example, intrinsic factors such as age, they are definitely more common in the geriatric population. Poor nutrition, comorbidities such as diabetes, hypertension, stuff like that can delay the healing process, and limited mobility. Extrinsic factors are ones that we as nurses can control, such as pressure, shear, and friction. And with these, we can always implement or talk to the provider about certain devices that we can use to prevent pressure ulcers or to make them not be as worse. So for example, like a air mattress or heel boots, stuff like that. So in terms of prevention, we want to turn our patients every 2 hours or as tolerated. Like I mentioned before, taking preventative measures such as an air mattress or heel boots, keeping the bed in the lowest elevation possible to prevent shearing, assessing nutrition, and providing supplementation, as well as reaching out to the nutritionist or the dietitian. The next wounds that we are going to talk about are arterial ulcers, and arterial ulcers are caused by impaired tissue perfusion. Having certain comorbidities such as peripheral vascular disease, diabetes, and vasculitis can definitely impact someone's risk of getting an arterial ulcer. So generally, arterial ulcers are more painful. They are nicely circular. So for example, if you see this picture up here, it's like a punch out hole shaped, and there's minimal drainage. They are typically found on the toes, the heels, and the lateral aspect of your feet, but that doesn't mean you won't be able to find one on an ankle or a shin, but they're generally more so located on these areas. Prevention includes checking feet and skin daily. This as a nurse and educating our patients. Managing comorbidities such as diet, exercise, testing, and medications. Educating about quitting smoking and maintaining a healthy lifestyle. Seeing a podiatrist. And watching for signs and symptoms such as pale feet, thickened toenails, and dry feet that can put an individual at a higher risk of arterial ulcers. Next, we're going to talk about venous ulcers, and these are caused by damage to the leg veins, which leads to retrograde or backflow of blood. Risk factors include obesity, deep vein thrombosis or DVT, smoking, and inactivity. With venous ulcers, they look a little different compared to arterial. They're generally not as painful. They're more irregularly shaped. So for example, if you look at this picture, the borders are definitely more irregular compared to the punched out hole shape at this one. And the tissue bed is generally red and granulated, and there's more drainage. They're usually found on the ankles, the calves, and the shins. Prevention, you want to check their skin daily. You also want to manage their comorbidities. With any of these ulcers, it's very important to manage their comorbidities. Educating about quitting smoking and maintaining a healthy lifestyle. Wearing compression stockings to help with the backflow of blood. And watching for signs and symptoms such as hyperpigmentation of the legs, edema, and varicose veins that can put an individual at a higher risk of venous ulcers. Last but not least, we're going to talk about diabetic ulcers, and these are caused by nerve damage and blood circulation problems due to a history of diabetes. Patients will develop a pins and needles sensation to their feet. Generally starts out at the distal tips, and this in turn causes them not to be able to feel if they, for example, step on a nail. Diabetic ulcers are generally not as painful. The edges are pretty calloused. The tissue is pale in the wound bed, and they are crater shaped. And they're usually found on the plantar aspect of the feet and distal tips of the toes. In terms of prevention and treatment, you want to check their feet and shoes daily, make sure that their shoes are not ill-fitting, managing their blood sugar, making sure their A1C is within normal limits or within a good range. Of course, educating about quitting smoking and maintaining a healthy lifestyle, testing the water temperature before bathing, and referring to a foot and ankle specialist, as well as offloading. Education is very important. Primary prevention is more important than anything else. We want to prevent these ulcerations, these wounds, these sores from forming. So always educate your patient about good hand hygiene prior to wound dressing changes, assessing for redness, swelling, drainage, and increased odor or pain, and talking to the provider about it, changing the dressing as ordered by the provider, using offloading techniques such as heel boots or diabetic footwear, checking for foreign objects in the shoes to prevent trauma or any mechanical ulcerations that can worsen, checking skin and feet daily, asking a family member for help or using a mirror. Like I mentioned earlier, contacting the provider if there are worsening symptoms, adopting a healthier lifestyle, and of course, referral to a nutritionist, a podiatrist, or a counselor as indicated and needed. Referring to a counselor might be important because wounds will definitely affect your self-image, so that is something to look into. And thank you.